Hi, everybody. We just have another couple of people joining us. Want to get everyone situated, then we're going to get started. Welcome. Hope everybody's doing well. Feel free to say hello to each other in the chat box and let people know where you're from and anything about yourself that you'd like to.
Hi, everyone. My name is Chandra-Mouli. I work for the World Health Organization, and I work for the Department of Sexual and Reproductive Health and Research. And I lead WHO's work on adolescent sexual and reproductive health. In this presentation,
I was going to introduce you, but
okay, go ahead, please.
You did half my job for me. Thank you. Well, let me just take a moment to say hello to everybody and welcome again. Thank you so much for joining us, and Chandra, thank you so much for spending the evening with us. Folks may not realize that it's midnight where you are, so I'm especially grateful for you waking up or planning your day to make some time for us. My name is Bill, and I'm the editor of the American Journal of Sex Ed. And again, our speaker this evening is Dr. Venkatraman Chandra-Mouli, who leads, as he said, leads the Adolescent Sexual and Reproductive Health program at the World Health Organization's Department of Reproductive Health and Research. He is the co-author, along with 7 other authors, who wrote What Did It Take to Scale Up and Sustain Udaan, a school-based adolescent education program in Jharkhand, India, which was published in the American Journal of Sexuality Education. He's going to speak for about 15 to 20 minutes, and then we'll turn it over for Q&A. So welcome, and thank you again for speaking this evening.
Thank you, Bill, and thank you for the opportunity. I'm based in Geneva, Switzerland, in WHO's headquarters. And when I registered for this workshop, I did so in a hurry and I didn't check the time. And it's midnight now, but I'm pleased to talk to you. And I have a good working relationship with Bill and with the journal, so I'm very pleased to contribute to this session and to look forward to the discussion. So, although the title of this session is about Udaan and one program in India, what I'm going to do in this presentation is talk about Udaan and talk about a number of other initiatives and tell you a little bit of a story of where sexuality education is around the world and in Texas as well. So we'll get a perspective of how it relates to the situation in at least one state in your large country. I'm trying to move my screen. Yeah. So there's an enormous body of evidence on sexuality education. In 2018, the United Nations, led by UNESCO, published an updated international technical guidance on sexuality education, an evidence-informed approach. There is considerable evidence on the cost and cost effectiveness of sexuality education based on studies done in a number of countries. There are studies on scaling up and sustaining sexuality education from a small and growing number of countries. So there's a fair and growing body of evidence. There's a plethora of tools. Tools for advocacy, tools for designing and managing programs, and tools for measuring programs, tools for process evaluation, outcome evaluation, program monitoring, so a whole body of tools. But the reality in the world is that most sexuality education programs are weakly designed, have weak content, and poor delivery. This is a set of studies from Nepal, which pointed to just this. Often important aspects of sexuality education are left out in the design because of discomfort, because of fears of corrupting children and adolescents, and this whole issue of discomfort with premarital adolescent sexuality. Yeah, and that's really true in the world, apart from a small number of Scandinavian countries and other countries in Northern Europe. The discomfort with adolescent sexuality seems to be, cut across centuries, and even today, in the 21st century, is very much a part of the reality of the world. Poor delivery. And, tied in with this is teachers who have never had any sexuality education in their lives, have never talked about sex with their parents, have perhaps don't talk about sex with their spouses, are now suddenly in between trigonometry and geography are supposed to talk about sexuality, about puberty, about masturbation. And the reality is that they don't. They don't in England, they don't in Bolivia, they don't in Uganda. And in many places, what happens is there's backlash. I come from India originally. So, you had the functional adolescent education program, and then a right-wing government comes into place and then says, this is against our culture, our rich, ancient, proud culture. These are Western imposed ideas brought in by the United Nations, and so we don't want this. And so sexuality education has been banned in a number of states. Egypt, this slide talks to the story in Egypt. Arab Spring, everyone thrilled with the possible change that it might bring. It's actually pushed back discussion on sexuality and sexuality education in Egypt, in Tunisia, and a number of other countries. So the reality is, as the Secretary General of the United Nations said in a report published in 2014, most adolescents and young people do not have access to sexuality education, despite intergovernmental agreements to provide it, support from the UN system, considerable project level experience in a wide range of countries, and research showing its effectiveness. In 2015, Nicole Haberland and Deborah Rogo from the Population Council did a review and published and found the limitations listed on the slide in red, which I won't read in detail. And this very interesting paper by a Dutch group in Rutgers did an analysis of the barriers to school-based sexuality education. They talked about, what we want is good quality sexuality education, which maintains fidelity and dose, so well delivered. But there are barriers at the student level in terms of competing tasks and feeling safe to engage, barriers at the teacher level, barriers at the school and organizational level, and barriers at the contextual level. So, the reality is that you want a teacher to come and talk about sexuality education in a school when a teacher himself or herself is uncomfortable with the content or is experiencing gender-based violence at home. It's very hard for her or him to come and deal with these issues in school. So there are barriers at a number of levels. So the bottom line is this. I'm 61 years old. I grew up in India. I've lived in Switzerland for the last 25 years. I learned about sex on the sidelines of the school playground from a friend. And when I was 16 and doing biology, the teacher hemmed and hawed and then said, you can read this chapter on your own. There'll be no questions about this in the exam. The difference between then and now is that now young people can go into their rooms, close the door, and access hardcore pornography, but can't get questions such as, why are my nipples tingling? Or why are my breasts not as big as my sister's breasts? Or why is my left testicle hanging slightly lower than my right testicle? There's absolutely no one to answer these questions, but you can go and see pornography. And so what we've been doing is we've been drawing lessons from positive deviant countries. It's easy, it's nice and easy to sit down and talk about all the problems of the world. And there are problems in sexuality education, in the response to COVID-19 and in everything else. But what we've tried to do is to look at where the glass is half full, see where programs are being delivered. And they're being delivered successfully in the most unlikely places, as you will see. 5 points. One is, how did they place sexuality education? How did programs which succeeded place sexuality education on the national agenda? And a very good example is Nigeria. We published this paper on in the Sex Education Journal some years ago. What they did was they demonstrated the need for sexuality education. There was an HIV epidemic. Young people were affected more than any other population group. Non-government organizations demonstrated the need, the feasibility. They developed a national coalition to advocate for it. The coalition worked with a number of internal and external change agents, and they developed a national policy which was then rolled out in all the 36 states of the country. Not perfectly, clearly with many flaws, but a national program. The second is, countries that have delivered sexuality education have planned the scale up from the start. And a good example is Zambia, with support from the Eastern and Southern Africa Commitment, a Swedish government-led initiative which involves 21 countries of Eastern and Southern Africa. What they've done is they've revived and strengthened sexuality education programs, all captured in this wonderful collection of case studies from which I've drawn this text. So they made strategic decisions, and then they operationalized these decisions in terms of who's going to deliver it, with what material, to which students, in terms of what content, how would teachers be trained, how would they be supported, how would religious leaders be engaged. Thorough planning went on. So they put it on the agenda. They planned it well. But the bottom line in everything else is, how do you manage programs? And this is where the Udaan program comes in. The Udaan program, that is the title of this session. The Udaan program is carried out in one state, the Jharkhand state, which is one of a slightly backward state, not one of the rich states, not one of the progressive states, but it is a state where a non-government organization called the Center for Catalyzing Change, with support from the US Los Altos-based Packard Foundation, has supported the Jharkhand government to deliver sexuality education. So it's a partnership. The government departments doing ownership, leadership, integration, with the district education officers implementing and delivering the education, with the Center for Catalyzing Change doing the hand-holding, the mentoring, the training support for the teachers, and the Packard Foundation providing long-term funding, small amounts of funding for the work of the Packard Foundation. The entire delivery of the sexuality education is by the government with indigenous funds. But what's particularly interesting with the Jharkhand example is they've done evaluations 2007, 9, 10, and 11, and they've gone on. And what is particularly useful was they only got permission to do sexuality education for secondary school pupils. But they were able to use the data to show to leaders in the state that most kids in 10 and 11 standards of schools, that is, I don't know how it works out in the US, but senior secondary school already knew what they wanted to know, and they were busy with preparing for the exams, and they were not really interested in this. On the other hand, primary school students, junior secondary school students entering puberty had many questions that they wanted answered. And they got the permission of the state governments based on data that they generated to take the education to a lower age group. The fourth point is, how do you promote and safeguard sustainability? It's nice to put this in place, but as you know from your own country, you have a change from an Obama government to a Trump government, and everything goes out of the window. How do you prevent that from happening? And what many countries have done is try to integrate it in not just national policies and strategies, but to try to integrate it in many other systems and into indicators. And so, what happens is it's much more difficult to disentangle it and take it out. Uruguay has done that, Argentina has done that, and they've cleverly integrated it into the work of many different sectors in many different ways. in the Department of Education, in the Department of Technical Education, in Women and Children's Affairs, in citizenship building. And so it kind of becomes part of different government departments, and then it generates many champions who cannot be silenced very quickly if there is one government official who dislikes it. Then the fourth point is, how do you build support while anticipating and addressing opposition? And this is something that you see around the world. I'm going to skip Nigeria because I've talked about Nigeria. I'm going to talk about Texas. David Wiley published this paper again in the American Journal of Sexuality Education last year. Again, thank you, Bill, for giving us the opportunity to publish this paper in your journal. Now, he's from San Antonio. And, you know, Texas is in the US, for me, having worked in many, many countries, what you don't have a national policy, no state policy, no county policy. So much of the discussion on sexuality education is at the school level. And it's the school shack, the school health committee, which then has to deal with these issues. And then what you have is these groups with vested interests and lots of money trying to block this. So what he's done is documented how at the local level, they have built support in the shack and dealt with resistance by lobbying school advisory council members and building trusted relationships over time to protect these education programs. And from what I read about the US and what I read now in a growing number of countries, these battles have to be fought at the local level, in school by school. So in some countries you can, in Germany, in Switzerland, in France, in the Netherlands, it's at the national level, it's been done. In Germany, it's been done for 60 years. You know, but sadly, in places like the US, it has to be done school by school. Mexico is another country where what you have is a program which has been in place for 30 years now, being attacked by the evangelical church, funded by US evangelical church groups, but also by indigenous groups. And so what we've done is with collaborators in Mexico, identified where the barriers are, who's coming with them, how are they manipulating the media. Initially, it was just the Catholic Church, but now what you have is a whole group of bodies who are opposed to gender ideology, who are opposed to LGBT issues, who are opposed to many different issues. Then finally, the example of Pakistan. Now, Pakistan is an Islamic country. If you read the press, you know, it's falling apart because of Islamic fundamentalism. But there's a national policy in place in Pakistan which allows sexuality education. What you have is a clever group of non-government organizations which have built support for sexuality education by strategically choosing issues. When there's a case of child sex abuse, they use that to create support in communities for addressing this among girls. They've framed the issues with care. They don't call it sexuality education. They call it life skills-based education. They have sensitive content vetted by the press, by religious leaders, by human rights advocates. And most importantly, they deal with backlash. Now, backlash in Pakistan is no different from backlash wherever you have bullies. And so essentially in Pakistan, how it works is fringe government groups, political groups, religious groups, and media get together and start threatening organizations which are doing this. They have learned and developed a standard operating procedure for how to deal with this backlash. For instance, if a court case is launched against an organization, they already have a lawyer who knows how to deal with it. The head of the organization takes this on and they go to the court proactively, and the bully backs off, like all bullies do. So they've learned how to deal with resistance. And my last point is this. Pakistan has shown us that the path to sexuality education is messy. In 1995, they did a study of needs. They introduced, in 97, they introduced life skills-based education in the community. 2005 in primary schools. In 2009, there was a government pilot. There were terrible floods in Pakistan. Everything stopped. 2011, they did another pilot. And then there was a massive backlash. The memorandum of understanding that they had was stopped. They took some time to regroup. They started a third government pilot in 2014. And now they're implementing it with a government MOU in a growing number of provinces. There was a case of Zainab, the sexual abuse, terrible sexual abuse of a young girl. There was an outcry for government action, which they then used to generate community support and governmental support to scale up. Sadly, sexuality education is not going to be like treatment of childhood diarrhea or pneumonia. It's going to be like this. It's going to be 2 steps forward or 3 steps back, or like a snake and ladders game. And that's really what we have to learn. Whether we are dealing with liberal Western democracies, or whether we're dealing with, Islamic states or Hindu states or Catholic states, the reality is, people are uncomfortable with adolescent sexuality. People want to control women's sexuality, and any discussion which empowers young people to talk about sex and to take charge of sexuality in their lives is going to be very uncomfortable to some people. And so for those of us who are championing this area, that's something we have to recognize and move forward. I'm going to stop here. I'm very glad to respond to comments and questions. I'm also very glad to respond to emails. And you have my email address on this slide. Over to you, Bill.
Thank you so much. Let me ask a question first, and then maybe we'll get some questions from the audience. Are your slides available? Can we make those available for participants?
Absolutely. I can send them to you right away after this by email.
Okay. All right. Thank you so much. So does anybody have a question that you want to come off mute? That would be my preference. But if you're feeling like you want to drop it in the chat box, that's okay also.
What I'd like to hear is, what are your reactions to what's happening in your I presume that most of you are from the US. Is what is happening in Texas reflective of what is happening where you live?
I could say I could definitely relate to the 2 steps forward, 3 steps back. It feels like a constant shuffle step. And I would say that's across my almost 30 years in the field. So I relate. So it's interesting to hear, that this is a common theme throughout many other parts of the world. What do other folks think? Wow, we usually have a chatty bunch.
Well, I just simply wanted to say thank you, that I really enjoyed this presentation, and it has inspired me quite a bit in the work that we're doing in the state of Oregon and Pacific Northwest of the United States. And yes, steps forward, steps backwards, pausing. So thank you.
Thank you, Frederick. I come from India. I come from a family where my paternal grandfather did his PhD in Wisconsin University, and my maternal grandfather was part of the British Indian Army and served in Aden in the Second World War. But when my mother had her menstrual periods, my mother is 91, and she did a graduate degree in mathematics. But when she had her menstrual periods, she was not allowed in the kitchen. And that's true for many of us in India. There was no discussion about sexuality. And so, to try to start talking about these issues is very important. Increasingly in the global community, And I pointed to one tool, the International Technical Guidance on Sexuality Education. One of the messages it points to is, you don't need to start talking about sex. I think it's very useful to start talking about, with very young adolescents, about their bodies, about how their bodies and minds are developing. And, you know, helping young people understand and build equitable gender norms. You've had a lot of tensions in your country about race. You know, in my country, we have these tensions about religion and about caste. Long after the caste system was supposed to be eradicated, it's still very much a reality. And some of these issues you can start talking to children and young people about, you know, who am I? You know, what is my place in the world? What's my place in communities? What are my thoughts? What are my, and those are things that make it easier. There's much more comfort in puberty education. And so in many countries now around the world, there's readiness to talk to girls about menstruation, to prepare girls for menstruation, so that, you know, they are not you know, shocked when they start bleeding, like so many girls are in so many parts of the world. So you can, otherwise sexuality education begins with, you know, let's tell them not to have sex, or let's tell them that, you know, abstinence only. But you don't need to start with that. You can start with, you know, this is how your bodies are built, and this is how as you grow up, you'll start thinking. And these thoughts that you have about sex are not wrong. Everyone has them.
I want to lift up a couple of comments from the chat. I'm not sure if you're looking at the chat, but Shirley is commenting about how things are different district to district, and that's certainly something that I've observed in my practice in New Jersey and in Pennsylvania. One of the things I notice in Pennsylvania, where I live, is that there seems to be a general lack of awareness that people are supposed to be doing sex ed at all, and that's because there's really a lack of standards. We're supposed to teach about HIV prevention, but, you know, everything else is really dependent on the teacher comfort and the school's priority and catering to the loudest parent usually.
Yeah,
Holly is
absolutely, Shirley. It is district, it is very localized, and that's why, you know, having, you know, I was born and brought up in India. I lived for 10 years in Africa, now 25 years in Switzerland. What I see here is, when you have a standardized approach to teaching, you know, we teach our kids how to cross the road. When my daughter goes to school here in Switzerland, a police officer comes to the school to tell her, you know, tell the kids how to cross the road safely, and, you know, how to ask for help when they are lost. And so we teach them to cross the road. We teach them how to not to put their fingers in electric sockets. We teach them how to cut, you know, loaf of bread, how to get the right change when they go to buy something. But we don't teach them about this. And what they do in Europe is very progressive. They say that, you know, we need to teach young people about their bodies, about relationships, about and because they have a right to do that. Not because we want them to behave in a particular way. What they do with their behavior is up to them, but they have a right to be informed and make the choices that they want to. And that's something I really hope that we can come to.
Holly is echoing the same comments, similar comments about school district to school district differences. Thank you for that, Holly. And Bianca has a question. I think we only have time for this one question because we have to wrap up soon. So Bianca is asking, what do you think about Georgia's new law on women's reproduction? And do you know about that, or can we ask Bianca to say a little bit more about?
I'm sorry, I don't know. I don't know about this particular law.
I'm sorry, Bianca. You caught me off guard also. Do you mind sharing a little bit more about a little context? I know that Georgia's made a lot of messed up laws. I don't know about the...
I know that in the context of COVID, they made abortion services as not essential.
Is that right? Okay.
I don't know if this is one of the issues. And if this is what you're referring to, I think it's absolutely terrible. You know, it's you know, for me, and abortion services should be made available. This is what we recommend. Countries have to make their choices, but this is what we recommend. This is an essential service. This is about right of women to make their choices. Now, one of the things I'd like you to think about is how can we move from local level to at least state level decision making? My son studied in Vancouver. Why is it possible in Vancouver and when it's not possible just across the border here? Because unless that happens, we're not going to be able to deliver sexuality education at all. Somehow we need a movement to get these decisions at least at the state level. Bianca, would you like to say something about the Georgia rule? Okay, I think I know you have to go to another session, so I'm happy to share my slides. I strongly encourage you all to look at the UN technical guidance on sexuality education. I'm going to send both these documents to Bill right away. And I think it's a wonderful document. One very important thing is it talks about sex positively. It doesn't talk about sexuality education to avoid health problems, but it says that sex is pleasure, sex is pleasurable, sex is something that we all, most of us have in our lives. And we need to prepare young people for a healthy and responsible sexual life. And that includes sexual pleasure as well as avoiding health problems. Very much like WHO's definition of health. Health is not just the absence of disease or infirmity, but a state of positive physical, psychological, and social well-being. And just like everything else, masturbation is fun and sex should be fun. And that should be at the basis of what we do in sexuality education.
Thank you, Dr. Chandra. Thank you so much. I have a couple of wrap-up notes and links that I want to drop in the chat box before you go. First of all, if you're not signed up already and you want to come to Dr. Mary Jo Pojersky's session on Sex Ed is in Session, there is the link. A couple of other things. I want you to have, there's two more links that I want to drop in. You may have gotten the emails already that about the upcoming July schedule. We're going to begin charging for these sessions. I'm really sorry. It pains me to do that, but I want to be able to offer the speakers honoraria. And so we're going to try that going in July and also pay for these Zoom expenses and all that kind of stuff. But I also, please don't let that stop you from coming. If you need a discount, if you need a full scholarship, there's a form, just sign up. I'm going to be as generous as I can in giving those out. So thank you all. Thank you again, Dr. Chandra, for
Thank you, Bill, and thank you all for joining me and for this discussion. And I wish you all the best as you deal with the COVID-19 pandemic in your country, as you find healing with the Black Lives Matter crisis and move on to the great country that you are. Thank you.
Thank you. Take care, everybody. Maybe see you at 7, if not next week. Take care. Bye-bye, everybody.